Well, hello there. I'm Penny Reed. I'm excited to be with you on this episode of the Huddle monthly video blog. And ironically, this month's topic is the Morning Huddle. Why is it so important? Well, just like with a sports team, if you've ever played sports or seen sports movies, there's always that locker room scene where they review the game plan about going out and putting together a winning game and winning plays to make everything they can out of the next 4 quarters. Well, the Morning Huddle is to help you guys make the most out of your day that's in front of you. And if you really want to make the best out of that, you will have a written checklist, because what's worth repeating, what's worth being consistent with, is worth writing down. And also, when you're going through your steps, sometimes it's easy to forget one. So very important to create your own checklist and write this down. If I could give you 7 things, which I'm about to, that you want to be sure that you cover in your huddle, here's what they would be. One is, where do we put those emergency patients? More than likely you came into the office this morning and had a voicemail full of patients that have called that need to be seen today or think they need to be seen today for a dental emergency. So identifying where is the best place to put those. Second is, what production opportunities are available today? Unfortunately, you might have had some last minute appointment changes. So what's available, making the team aware of that, not only for today, but the next 2 business days. That way we have specific appointment times to suggest to our patients. And it's quite likely that some of them might want to stay over and get their work done today should the time present itself. Also, openings in the hygiene department. Who might be coming in an operative that actually needs to be seen in hygiene. Also, what trouble spots are there in the schedule? As we know, the schedule can make or break not only our stress level, but also profitability. So what might have too much time? Where do we not have enough time? Who might we need to call to make an adjustment to possibly come in a little earlier or later? The fourth thing would be, who will we use the intraoral camera on? And of course, you know, my answer would be everybody. But if we don't have the equipment to be able to do that, or we're not yet in the habit of using it with everyone, be sure we use it on the new patients. Also on patients who have an outstanding treatment plan and haven't taken action, that's a great tool to use the camera or pull up prior images. Or if it's been lingering for a while and we have prior images, show them, here was the old image, here's what it looks like today. How do you think you need to proceed? Huge, huge tool for case acceptance. And then also utilizing that with our emergency patients is a great way to help them really see what's going on in their mouth. The next step would be actually asking for referrals, identifying who will we ask, who will we give referral cards to. Usually the best ones are new patients. They're not normally more enthusiastic about you after that first visit or the first 30, 60, or 90 days as they are later on. So that can be a key time. Also, the patients that have referred already, those are great people to ask. And then anyone that gives you a compliment, and be sure that we're giving them a referral card so that they can invite their friends and family. Next, who might have slipped through the cracks that needs to have a financial discussion before we pick up the handpiece. All right, so that's not the time to make the financial agreements. This is just sort of a safety net so that we are being sure that we've got those in place before we actually do the work. And last but not least, who might be a candidate for additional services. So let's say, for example, teeth whitening. If we have patients that have inquired about it before, letting them know what we have as an option for same-day whitening if they can stay today. Or if it's a patient that looks like they could be a candidate, being sure that we have a baseline shade, putting the shade guide in their hands, letting them pick up the one that they think most identifies with them, looking in the hand mirror and letting them see where they are, and then it will usually evoke a question for those that are interested in whitening. So that can be a great way to add on production for that day or a future visit. Or if we offer Invisalign or 6-month smiles, a service like that, who might be a candidate for that as well, where we can start that conversation. So from these 7 steps, you've likely identified some things or maybe thought of some other areas that you would like on your Morning Huddle checklist. So be sure and create that, have it posted. Some offices will even laminate it so that it's easy to see, and be sure to utilize that in each morning huddle. It's been great being with you today. I look forward to our journey together as we work toward improving things in the dental office. And if you would like to reach out, you can reach me at my website. There's a contact form. The information is on the screen, or call the toll-free number. It's been great to be with you today, and I look forward to hearing from you. Make it a great one.